years ago, we believed that it was the physician who was solely responsible for treating us. But thanks to the work of Dr. Jeremiah Stamler, we now know that our health is partly our responsibility. What we eat, how we move, exercise, how well we sleep, and how we deal with the challenges of our daily life have a deep impact on our health and particularly our heart health. The good news is that with the advancement of technology and findings in research, prevention is far easier today than 100 years ago. Considering all of you out there know someone with a cardiovascular condition, wouldn't it be awesome to understand a bit more about prevention when it comes to cardiovascular conditions? Namaste, I'm Nutan Manohar, adjunct faculty with IIM Kozhikode, guest lecturer at JIPMER and various other institutions, founder of Me Met Me, and on behalf of Times of India, I wholeheartedly welcome each one of you to the Times of India World Heart Day Symposium 2023. Every beat counts. At its core, cardiology revolves around the principle of good heart health, and this is done through prevention, diagnosis, and treatment. It emphasizes the importance of medical interventions as well as lifestyle factors so that you can reduce cardiovascular diseases. The principle of cardiology also encompasses the utilization of advanced diagnostic tools such as echocardiography, cardiac catheterization to assess heart function and structure accurately. After all, no two hearts are the same. The session by Times of India World Heart Day Symposium 2023 is dedicated to exploring the principles of preventive cardiology, a topic of utmost importance in our quest for heart health. We have with us distinguished panel of experts with each a stalwart in the field of cardiology. Please allow me to introduce each one of them. We have with us Dr. Y.K. Mishra, Chief of Clinical Services, Head of Cardiac Sciences, and Chief Cardiovascular Surgeon, Manipal Hospitals. Dr. Yugal Kishore Mishra is a distinguished cardiovascular surgeon with over 30 years of experience and has conducted over 23,000 heart surgeries. He's an excellent resource person for robotic and minimally invasive cardiac surgery. He's a prolific researcher with over 200 publications in renowned journals and books. Driven by a passion for teaching, he trains national and international trainees. He served as the president of Indian Association of Cardiothoracic Surgeons in 2018 and founded the Society of Minimal Invasive Cardiovascular and Thoracic Surgeons of India. Additionally, he contributed to the board of directors of the International Society for Minimally Invasive Cardiac Surgery and established the Pai Suni Charitable Trust for Cardiac Health Awareness. Thank you, Doctor, for joining us today.
Thanks.
We have with us Dr. Tarlochan Singh Kler, Chairman, Fortis Heart and Vascular Institute at FMRI, Gurugram, and Fortis Hospital, Vasant, Kunj. Dr. Kler got his medical training from India, UK, and USA, and was one of the founding cardiologists of the famous Escorts Heart Institutes, New Delhi. He's one of the pioneers in cardioelectrophysiology and interventional cardiology. He had set up the first dedicated department of electrophysiology in India at Escorts in 1993. Dr. Kler introduced many new medical technologies in India and South countries. He implanted the first ICD, first CRTP, CRTD in India, and also did the first conduction system pacing in 2015. He has more than 150 publications in national and international journals in his name. He has received many awards like the IMA Lifetime Award, DMA Centenary Award, Great Son of India Award, Legend in Medicine Award, Revered Teacher in Cardiology Award, and above all, Padma Bhushan by the Government of India in 2005. We are honored to have you here with us, Dr. Kler.
Thank you. Thank you, ma'am.
We have with us Professor Dr. Ambuj Roy, Professor of Cardiology and Head, Skill E-Learning and Telemedicine Facility, AIIMS Delhi. Professor Ambuj Roy, a cardiology professor at AIIMS Delhi, heads the Skill E-Learning and Telemedicine Facility. He is a nodal officer for the National Medical College Network, connecting Indian medical colleges for telemedicine education. A fellow of American College of Cardiology, National Academy of Medical Sciences, and Royal College of Physicians, Edinburgh. He's a former convener of the Heart Failure Council, Professor Roy's research centers on cardiovascular epidemiology, heart failure, and technology-driven CV risk factor management, yields impactful studies on alcohol and influenza vaccines' role in cardiovascular disease prevention. He's actively involved in advisory committees for India's Ministry of Health and Family Welfare and ICMR's Cardiovascular Research Task Force. It's an honor to have you with us, Doctor.
Thank you, sir.
And we also have with us Dr. Upendra Kaul, Chairman, Batra Heart Center. Dr. Kaul is an Indian cardiologist, one of the pioneers of non-surgical cardiac interventions in India. He has an international reputation of being a teacher and an academician par excellence. Professor Kaul has received recognition in the form of Dr. B.C. Roy Award and Padma Shri. He is also the editor-in-chief of the journal Asia Interventions. Dr. Kaul is the founder-director of an NGO, Gauri Kaul Foundation, and has traveled to various remote parts of Jammu and Kashmir, educating on preventive strategies and also establishing telemedicine systems. He is also a passionate writer about the heritages of his homeland, Kashmir. Thank you, Doctor, for joining us today.
Thank you.
Thank you so much. Let's dive right into our discussion on the principles of preventive cardiology. We'll start with Dr. Y.K. Mishra. Dr. Mishra, to set the stage, could you help us understand the current overview on the state of cardiac health in India? What are the prevalent issues and who is more susceptible for heart-related problems?
So, as you earlier mentioned that prevention is better than treating any problem, and so is also with the heart. The luminaries who are in the panel, they all work very hard, including me, to try to spread the awareness so that the heart diseases may not occur. But this is not established so far, whether it's a government agencies or our private hospitals. We are basically learn to treat, but somehow, as a Gauri Foundation, you say, Dr. Kler, Dr. Kaul, myself, we together and individually went around the nook and corner of North India, try to reach out the villages and tier 2 or 3 cities to spread the awareness of heart health and how to prevent that. Unfortunately, our huge population and not enough support from governmental agencies for prevention. Most of the times, there is a Ayushman Bharat which established to treat the patient. Dr. Kaul has also worked in ICMR, which is a nodal agency for research. But somehow, today, we are in a platform in India where our most of the effort is towards the treating the patient instead preventing. Now, this is a just appropriate time to, whether it's a private hospital, whether it's a nodal agencies, whether it's a government initiated programs, we must give enough space for prevention, and there should be enough research how to prevent. Our area, which is Indian subcontinent, is a very peculiar area. We are seeing in Western world, now there is a decline in the coronary artery disease. But in our country, there is a rise in the coronary artery disease. We still not get rid of rheumatic heart disease. And also the congenital, there is a very dismal effort from either is a private hospital or some other agencies to identify and treat. We can prevent rheumatic heart disease. We can prevent coronary artery disease if we intervene in time and spread the awareness. Unfortunately, the congenital cannot be prevented. But these are the two segments where definitely we need to do much more to prevent instead treat these diseases. Thank you.
Thank you, Dr. Mishra, for all the work that you do for ensuring that there is awareness even in the remote corners of North India. And as you mentioned, yes, there is an increase in the cardiovascular incidences in India, and particularly among the youth. whereas in other countries you see that the first incidence is happening at a much later age. You can find that India is even particularly peculiar because you have younger and younger people succumbing to heart diseases. So thank you so much, Dr. Mishra, for that. Dr. Tarlochan Sinclair, if I could, building on Dr. Mishra's insights, what is preventive cardiology? Could you enlighten us on the pivotal role medical advancements have played in preventive measures? Are there any emerging technologies or treatments that offer new hope in this field?
I'll say, first of all, I want to say that in the world today, roughly 1/3 of deaths occur because of cardiovascular disease. Number 2 is cancer, and the other diseases are later on. So that means the cardiovascular disease is one of the most important cause of morbidity and mortality in the world. Now the good news is, which many people don't know, that there is data from the WHO, like in 2021, I think, I don't remember exactly, but about 6 million deaths occurred in the worldwide, and because of cardiovascular disease. But if we apply the preventive technologies, information available to us, 79% of these premature deaths are avoidable. 79%. So that's a huge number that we can prevent these diseases. And basically, when it comes to the question of heart disease, we by and large are talking about the coronary artery disease, the atherosclerosis, and this is number one cause. Now the thing is that it is not a rocket science, it is a simple strategy that we need to change our lifestyle. When we talk about lifestyle, is that very, very roughly, if I say that we need to go 50 years back, what our grandparents used to do. They used to work with their hands, they used to walk, they used to cycle. So we need, most important thing is that we need to continue walking, use our legs, which has been, a major kind of change, shift because of the advancement of automobiles, advancement of technology. People don't go, they order their pizzas at home. So physical activity, increasing weight is a very big risk factor. Because of the weight and because of the inactivity, there is a lot of incidence of diabetes in India, particularly young people. We never used to see diabetes below 50, 20 years back, now 30s and 40s, we see a lot of diabetes. Then multinational companies and the environment, competitive, people have stressed out, they smoke, they take, kind of very, very unhealthy food like pizzas and, burgers. And all these things are amenable to prevention, that people should exercise, no smoking at all in any form, and they should reduce their weight to a ideal level, 40-45 minutes of exercise at least 5 days a week. And if somebody has diabetes, controlling it with lifestyle change, reduction of weight, and plus minus the drugs to keep their hemoglobin A1C 6 to 7. And if you have hypertension, again, first strategy are lifestyle modification, meditation, yoga, very, very useful. But if still your blood pressure is more than 130/80, you need, in addition, medication. So idea is to keep blood pressure below 130/80. That is what WHO says. So proper control of diabetes, proper control of hypertension. Then lastly, maybe one of the most important thing is increasing levels of stress. We need to learn. See, stress is not going to decrease in the world, it is going to increase, but we need to learn how to handle stress, how we relax ourselves, whether you go to your friends, or you go to a temple, or you go to Gurudwara, or you sit with your own relations, family. So I think one of the most important thing in the today's world, as far as total health is concerned, is managing stress and giving some peace of mind to ourselves. That's what I would say the most important thing.
Thank you, Dr. Tarlochan. I mean, you have touched upon 2 points. One being, a sedentary lifestyle. I think that's an uphill task, considering that one, it's become easier to stay indoors. 2, that we do not have places where we can actually go and exercise. The ability to have free spaces where we can work out, etc., is actually coming down. So it's an uphill task. And on the other hand, you also spoke about, how do we become resilient to stress? I would also want to urge you on, is there anything on emerging technologies when it comes to preventive cardiology? Is there any insights that you would want to share with us on it?
Well, basically, when we talk about emerging technology, the technologies, basically are, for example, e-health, for example, distant health, education. Now we have technologies to spread awareness much faster as compared to what we used to do before. Like, if I'm very seriously have been saying many times, in this country there are maybe 80 or 90 Astha channels, teaching some religious discourses and whatnot, but there is no national channel on health. I think the government of India should set up a national health channel where people, specialists, experienced people can come and give talks in very simple language, and it's not a difficult job. So most important thing is health education. Use technology to spread the information, use television, use the e-media, go to start syllabus on health in schools. It's very important. Overall health, cardiovascular health, and sexual health, which is totally ignored in this country. So we need to start. If we start teaching school children after 5 years or after 10 years, I think a lot of people in this country can be educated.
Thank you, Doctor. Seems like the work that I do seems to be does resonate with what you are speaking about. So thank you so much, Dr. Kler. Professor Ambuj Roy, could you highlight some of the latest research findings in preventive cardiology and how they shape our understanding of heart health?
Yeah, thank you, Nutan, for that question. So I don't think we need any latest technologies, Preventive cardiology, thanks from our learnings from the second half of the 20th century from the West, we know what causes diseases, and that's been discussed extensively, whether it be lifestyle or it be diabetes, hypertension, cholesterol. These are very simple things. What needs to be done is how do you scale this up? In India today, we have over 300 million people with hypertension with 10 to 20% control rates. Across several studies, we have over 200 million people living with dysglycemia, meaning diabetes or pre-diabetes. How do you reach out to them? And the people, 1 in 3 people still smoke or use tobacco, smokeless tobacco. How do you reach out to them? That is what is needed. And here is where the emerging technologies are coming. And we have experimented with what is called mHealth. And we've run mHealth clinics in peripheral hospitals and shown that you can use technology to improve penetrance of management of diabetes, hypertension, cholesterol, lifestyle matters. This is called a clinical decision support system. So we employ this in peripheral health centers. The poor medical officer down there is not empowered to treat so much non-communicable disease. He sees day-to-day fever, pain, fractures, and so he's inundated with a lot of work. So how could we help him, improve screening for non-cardiovascular diseases? So these diseases do not manifest, diabetes or hypertension are called silent killers. So unless you go out there and measure somebody's blood pressure, measure somebody's sugar, you wouldn't know till he lands up with a complication that he has these risk factors. So what this technology does, it empowers the doctor who has a physician assistant, uses this technology, which is basically a simple tablet. He screens these patients for these risk factors, for the lifestyle risk factors, and the clinical decision support system. There's an algorithm within the tablet, and it throws up a personalized prescription, and the doctor vets it and gives it up. So unless you use innovative technologies, we are not going to reach the scale of management that is needed. And so, management of cardiovascular disease has to go beyond cardiologists, or even I would say beyond physicians, to the last physician down there. And we have to learn how we can take help of non-physician health workers in promoting cardiovascular health, because the scale at which we need to perform cannot be done by a panelist of cardiologists, cardiac surgeons sitting over here. So my point is we need to think out of the box And thankfully, this clinical decision support system, which we had developed as a group, has been adopted by the national NCDCPS, which is the National Program for Cardiovascular Disease and Non-Communicable Disease, and is incorporated in the CPHC platform. And hopefully in the future, we'll have empowered technology empowered clinics which can improve the preventions for cardiovascular disease.
Thank you, Doctor. Considering that cardiovascular diseases are the #1 killers in India, I think all of us have to work together to ensure that the last person out there actually have access to informed diagnosis and treatment. So thank you so much, Dr. Ambuj Roy. Next question is to Dr. Upendra Kaul, a question that is very close to my heart. Very recently, we were having this discussion and we realized that when it comes to cardiology, often the initial test is the stress test, a test that looks at your physicality. However, we already know that when it comes to mental health and cardiology, there is a very strong correlation. So if you could help throw some light on relationship between mental health and cardiovascular disease and how mental health interventions can be integrated into preventive cardiology.
I think this is a very important area. And, sitting in 4 chambers and discussing things does very little in this mammoth population. And I have the experience of moving around, in peripheral areas. And you would see how stress in the families leads to lots of problems, starting from obesity, starting from uncontrolled high blood pressure. And what you do, you go on increasing the number of tablets, you start combining 4 medicines and give him. And then you don't have time or you don't have the inclination to talk to the person, what is your problem? And once you try to get the problem that this is a mother-in-law, daughter-in-law problem, or is the problem of son not getting a job after, doing quite a bit of education where they've spent a lot of money on this. And that, what we call as the mind health, is actually extremely, extremely important. And one has to take help of spending some time counseling. But we have simple medications these days available, which are very safe medicines, and don't have to send the patient go to the psychiatrist and psychologist now. They're not going to go. Psychiatrist visit means that you are mad in our community. So you have to develop those skills and gently tell them this is a common problem and we'll sort it out. And by adding something like a serotonin inhibitor or something like that, you see he or she comes next time much better with half the dose of medicines, he getting control, and she or he feels much, much better. And we have this experience, I go to what is not very remote, but people get scared of going there, is beyond Pulwama district. Pulwama unfortunately has been, got into a bad name because of that thing which happened 3 years ago. We're not going to discuss that. But I go beyond that. I have made a center there which looks after 3 districts of Jammu and Kashmir: Pulwama district, Shopian district, and Kulgam district. This means a population of 9-10 lakh of population. And we kept simple equipment there, which has again been given to us by a corporate social responsibility. The building is only mine. And there you see how much gratified you get by seeing those, sick people. And sick people are always accompanied by, since we're talking of prevention, I'm not going to talk how wonders we can do to treat heart failure. That could be separate. Prevention of heart failure is very important. And Ambuj knows all that, what all he has done and we have all done, is to talk to the family, the relations, that you're all going to get into this because the environment is the same, the genes are the same, and more than genes, the environment is the same, the pollution is the same, what you eat is the same, your habits are the same. You're going to take 3 cups or 4 cups of salty tea during the day and then take a diuretics to eliminate that, excessive sodium. So such, places have to be used for prevention in the community, because everybody, an elderly person is accompanied by 3 more persons. And you sit 10 minutes with them, tell them, do you know your blood pressure? They don't know. You tell them that, do you know your collar size? Yes, it is 36. No, why don't you know your blood pressure? Similarly, you should know your blood sugar. These are some of the key things. every adult should know his blood pressure, every adult should know his blood sugar, and if possible, just a cholesterol done once in a year. If you know such things and you spread the message that this is very, very important in prevention of heart attacks and strokes and heart failure, I think the message enters there, and they start doing it. Even if 50% start doing it, your day is done. Your day is made, and that you have done something more than just prescribing 1 or 2 tablets. So I think counseling people and telling them what is prevention in very simple terms. You can't go with electronic gadgets and all that. They get scared. Give them a gadget. Similarly, finally the group of people have to be made self-dependent for prevention. That's how we have joined Dr. Dennis Xavier, and Ambuj would know him from St. John's in Bangalore. This is a support program. We have adopted Adopt a Village. This is the things which NGOs can do. Adopt a village of 600 persons where 30% of the population is more than 35 years of age, and just do their sugar, blood pressure. It's easy to do. Employ 1 or 2% because unemployment is also rampant. Tell them how to do it with a handheld small thing, and then tell them this is this, and now you have to look after your society. You don't have to give them medicines. Tell them these are the medicines. These medicines, easy medicines, are available by this what is here called Modi Ji's Dawai. So give them that medicine, and that's how then the community starts looking after themselves. And then you don't have to go again. You go to some other place and then reassess at the end of 6 months or a year, what have you done, and you find that you have done quite a bit of job. So that's what I would say, that prevention goes into the families so that you spread your message to a larger number of people rather than just the person who comes with disease.
Thank you, Dr. Upendra Kaul. So on one side, we have technological advancements, but on the other side, as a cardiologist in future, you see them becoming counselors and community builders to help ensure that, we can prevent cardiovascular diseases. Thank you so much for that. Take a little pause here. Thank you so much, doctors. So now it's 12:35, so we'll be kind of rushing through the next set of questions. I hope that is fine with all of you, so that we can kind of wrap it all up. Okay, thank you so much. So the next question is coming up to Dr. Yugal. Starting off again, 3, 2, 1. So with that, I have a question for Dr. Y.K. Mishra. Dr. Mishra, what advice do you have for individuals to stay motivated and consistent in maintaining healthy heart lifestyle to prevent cardiological issues?
Very nice questions, and I would like to elaborate in the sense particularly pertaining to the younger population, and also pertaining to not only the coronary artery disease per se, but we also have another problem, which is rheumatic heart disease. Somehow the Western world has get rid of these problems, but still, as a cardiac surgeon, every month I do at least around 20 cases of patients who come with rheumatic valvular heart disease. So let's start with 2 aspects. The one, our esteemed panel has already discussed the prevention of coronary artery disease, which everybody talks today. It's a talk of the town. But somehow there is a little effort to prevent another very important aspect in our country, which is rheumatic heart disease. Now there should be enough effort by the government. Government can do this, and that's because of improving your living conditions, sanitization, your lifestyle, nutrition, and where you live. We all know that's because of overcrowding. There are a lot of efforts, and when we, myself, Dr. Kler, were together working in the Fortis Scar Heart Institute, our team used to go to Punjab, and they used to do the echocardiography to find out. So Punjab is one of the developed state, but still there was a significant number of kids, school kids, they had rheumatic heart disease, which was diagnosed by echocardiography. So very important today is that we must not ignore the disease which is being eradicated from developed world. Though the rheumatic fever is declining in our country, but this is ICMR's data. Dr. Kaul is still, I think, associated with ICMR, but the big chunk of patients across the country are still suffering with rheumatic heart disease. Thanks to the various states and Modi medicines and all the states, they are helping out to get treated by surgery these patients, but that is not the crux of matter. Matter is to prevent. Now let's see the prevention in two aspects: the primary prevention and secondary prevention. Every year we do around 150,000 coronary artery bypass surgery. Our cardiologist colleague do around 4 lakhs of angioplasty. Now what happened to these patients who are already being treated? Now there is a responsibility of physicians, the society, the NGOs and everybody and the hospital to secondary prevent these patients so that they may not get another bouts of coronary artery disease. Or same way, rheumatic patient who is being treated, we deployed the valve, they come with clotted valves. Now the responsibility of the government is to give one-time money so that they can be treated. But what happens to getting a proper treatment post-surgery? Coumadin. If they are not going to get appropriate coumadin dose, these valves get clotted and they come with emergency with a clotted valve. So there is also a role of secondary prevention. Now you have said another thing which I wanted the last answer what you have said, healthy heart. What to do about this? Of course, everybody has answered that what are the risk factor. But unfortunately, today sitting here, we don't know the exact cause of coronary artery disease. We know that there is a high incidence of coronary artery disease in smokers, in diabetics, in obese, type 1 personality, or individuals in whom family there is mother and father has a coronary artery disease. Now there is a big research going on in some of the American university. My daughter is working on epigenetics and AI to correlate on the basis of epigenetics to find out a particular gene to find out whether that is responsible for coronary artery disease. Maybe after 5 years, we are going to, or 10 years, we are going to get the crux and the reason why the coronary artery disease occurs. And then we have a certainty to treat that. But today, definitely we have to rely on prevention. Prevention so that if there is a diabetes, has to be treated properly. If there is a smoker, he has to quit the smoking. If there is obesity, the individual should cut down the weight. High cholesterol has to manage, and of course stress, which is the biggest one of the killer. Now I just want to, at the last I want to answer that whenever we organize the camps, some of the politicians they organize, they gather the various institutions and doctors, and there are 10,000, 20,000 patients seeking the help of doctors advising these camps. Why? Why there is a necessity or need of these camps? It means that our health system is not efficient to provide the health at doorstep. That's why these people in 20,000 and the politicians take a glory that in my camp there was a 50,000 people visited in 3 days. That's not country needs. Country needs primary health centers, secondary district hospital. They should be equipped with and provide day-to-day need of these patients.
Thank you so much, Doctor.
The NGOs are moving on. Why the Gauri Health? Why Passionate Charitable Trust? Why we are moving on? Because the individuals are not getting appropriate advice, tests and medicines in their doorstep, in their villages, in their cities. So there, if we strengthen that by the government, by the NGOs or by any other agencies so that they can get advice, then only we can do a primary prevention and eventually the secondary prevention. Thank you.
Thank you, Dr. Mishra. Just another quick pause. We will be keeping our answers a bit shorter so that we can cover every question because all the questions are equally important. Okay, coming back to our 3, 2, and 1. So the next question I have is to Dr. Tarlochan Singh. Kler, in your experience, how can preventive cardiology strategies be tailored to suit different age groups and risk profiles? Because at a different age category, you have different reasons why you're getting cardiovascular diseases. So how can we have preventive cardiovascular strategies for different age groups and different profiles, maybe women and men, etc.? Thank you, doctor.
So I would say that we need to approach three kind of ages. First of all, there should be some kind of program to check heart of neonates when the child is born. Then when the child goes to school, there should be a cardiac checkup, because in India is the only country where you see congenital heart disease at the age of 70 years. So some of the diseases are missed, many times they are missed. So check up when the child is born, check up when the child enters the school. I think if we do that, we can detect congenital heart disease in time and those patients can be treated. That's number one. Number two is then when we talk about the adolescents, adolescents have a problem of rheumatic heart disease, as Dr. Mishra pointed out. Now, for that, we need just information that it is a consequence of sore throat, and if sore throats occur, they have to be treated meticulously in time. So that's the complication. And if a child gets pain in the joints, they should have a cardiac checkup. So rheumatic heart disease is decreasing now, particularly in those states where the socioeconomic status is better. Of course, we need to improve the socioeconomic status of people to prevent rheumatic heart disease. Now, after that, when we come 30s and 40s and plus, then the coronary artery disease takes very important area, and that is where we are all talking about use of health education. And if I have to be very brief, how can be three things can be very, very useful to kind of spread education, prevent cardiovascular disease. One is that there is a need to use more and more digital tools in our country, like artificial intelligence, like some of the technology Dr. Ambuj has discussed. And the distant medicine, for example, AI in a small hospital in a lay, a physician, if he has AI, he can feed the ECG and the diagnosis can be given. These are just examples which will come in the future. Then two principles. Tell people, you may be telling people that do exercise, go to gym, this and that. Most of them, many times they don't listen, they don't do. Just tell them one thing, that please adopt a philosophy of that I am not going to sit in the daytime. Don't sit. If I have the power, I will remove chairs from offices and I will remove chairs from the shopkeepers. They should stand so that they can continue walk. They can have a stool just for a few minutes rest. So continue walking, use your legs, very important. Thirdly, I think we need to tell our population that a disease doesn't come at the age of 60 on one day. It is progressing over years and years. So if you want to detect early, then a concept of annual health checkup has to be told to the society with few tests like blood sugar, cholesterol, as Dr. Kaul has also pointed out. Many people never see their blood pressure. Many people many check their blood sugar. So just an annual simple health checkup, I think, can go a long way to prevent cardiovascular disease.
Thank you, Dr. Kler. I particularly like the idea of removing chairs or even having standing desks to improve the incidence of sedentary lifestyle in India. So thank you so much, Dr. Kler. And with that to Dr. Professor Ambuj Roy, how can we promote heart-healthy behavior in children and adolescents in particular so that we can establish a foundation for lifelong cardiovascular health?
Yeah, thanks. Probably that's the most important question, and I promise I'll be brief. So, if we have to convert a so-called demographic dividend and not convert it from a demographic dividend to a demographic burden, we need to focus very early. There's a common saying that coronary artery disease begins from the womb to the tomb. It goes all the way, it has the whole spectrum. And you'll be surprised that children born to mothers who are famished and low birth weight children. If they gain weight rapidly, they are at a much higher risk of developing diabetes and coronary heart disease as they grow up. Similarly, coronary artery disease or a heart attack doesn't happen the day that it happens. It builds over years, and you need to intervene very early. And as you said, we need to do that, promote it in school health. And probably what we need to do is, along with teaching all that we teach our children, getting healthy behavior in the curriculum is the need of the hour. And we've advocated that for quite some time. We've not been very successful, but probably forums like this are needed to push the NCRT and all the authorities to absolutely get lifestyle diseases in the curriculum so that it can be promoted. And some of these lifestyles are not in your hand. I mean, air pollution today is one of the biggest causes or triggers for heart attack. So we need to create awareness for that. We need to have a better urban infrastructure. As you said, physical activity. If you don't have a road, how will you cycle? So heart diseases are not limited to individual risk factors, but societal, commercial risk factors. The way beverages are promoted, with the biggest stars promoting Coke and Pepsi, and any young child would fall for it. So there are several multitude of things that contribute beyond individual choices that contribute to coronary artery disease, and that creating that awareness in children who are smart, who are honest, and who have energy to change this world is very important.
Thank you, Professor Ambuj Roy. I mean, let's really hope that, NCRT, NEP, etc. comes into play when it comes to increasing, let's say, improved lifestyle choices among students, so that there is an establishment of foundation for lifelong cardiovascular health. So thank you so much, Professor Ambuj Roy. And let's definitely hope more and more celebrities stop endorsing, say, sugary water drinks. So I really hope for that. So thank you so much. And now we have Dr. Upendra Kaul. Dr. Upendra Kaul, we kind of touched upon the role of genetics and epigenetics. So if you could help us understand what is the role of genetics in cardiovascular diseases, and how can this knowledge be used for prevention?
Well, genetics is important. If, giving a simple example, if one of the parents has a heart disease, whether it is congenital heart disease, like a hole in the heart and he had been treated or he did not require a treatment, or the patient has what is we talking about a lot, ischemic heart disease, or a cardiomyopathy, any kind of heart disease, if one of the parents has, the chance of getting it into the sibling becomes higher. And if both of them have some kind of a disease, because especially in some of our, in South India or in Muslim community, intermarriages are common, so it becomes even more frequent. And then, like the Parsis, they have, again, a small community marrying within the community, these problems increase. So one is that. But equally important, what you call as epigenetics and other things, is the environment. I did touch it when I was, I think, answering your first question, that genetics goes with the environment, and the family has an environment which has a very important bearing on the other risk factors, like, mutton eating family. They're fond of mutton, so their children are going to be craving for mutton if they are not going it. No exercise, obesity, father smoking, or father drinking too much, the child feels that, a strong man must drink. So all those things come from this thing. Pollution, if you're living in a ghetto, or this is a, paper mill or something next to your house. So all those things communicate. So genetics, when it is combined with a bad environment or an unhealthy environment, gets you into much more problems. So genetics is important. These people who have genes predisposed to this should start all these preventive measures much more aggressively than others. Not that others should not do it, it should be much more aggressively, and you are going to get dividends out of it. So I think environment and genetics are linked and cannot be separated, and you have to act on both, because you can't choose your father after you are born. You have that. Okay. Thank
Thank
you.
you,
I think.
doctor. You can't choose your father, but you can definitely choose what kind of environment you subject yourself to, what kind of behaviors you adopt in future part of your life. So thank you so much for that empowering note where we realize that there's a lot more in our hands and we don't have to really depend on our genetics for good health. So thank you so much. And with that, thank you, Dr. Mishra, Dr. Tarlochan Sinclair, Professor Ambuj Roy, Dr. Upendra Kaul, for your invaluable insights and expertise on the principles of preventive cardiology. You have truly illuminated our path toward better health through principles of preventive cardiology. We also extend our gratitude for all the organizers who made this insightful discussion possible. Ladies and gentlemen, we hope this discussion has shed light on the importance of proactive heart care. Remember, every beat counts, and by following these principles we discussed, we can take charge of our heart health. Thanking you all for joining us today. This is Times of India World Heart Day Symposium 2023. Every beat counts. Have a heart healthy day. Thank you.
Thank you.
Thank you.
Thanks.
Thank you so much.
Thank you.